And we are back with Dr. Cardi Taub, Cone Health cardiologist and medical director for the Women's Heart Health and Cardio Obstetrics Clinic. So we were just talking right before the break. All right, sometimes we think we just have a tough week. Oh, I'll get to the doctor later. Is there something, how can we make it easier for women to do that?
I think there's multiple ways that we can do those things, because the first thing is, if the woman is already established with a primary care provider, take the first step. Call the office, see if they're able to see you. And there are other options that you can take, like the virtual visit option, look, the telemedicine, pretty much that is. And if you don't have a primary care physician or provider, these are other steps too. And I know our organization, we're able to connect people to care, make sure that people have the right types of screening that they're able to do once they're connected to this care. But what I'd like to say, though, to any woman that's really listening today is, please don't wait. Today is the day. The day that you are feeling ill, the day that you feel you have that tiredness that can't go away, the day that you're having that chest pain, it's the day that you really need to call in, and the day that you need to seek care. So that's really important. And if you feel that you're not able to do that, 911, those are always the ways that you can make sure, because there are times where you can get to a point where we may not be able to do too much, but we can prevent any type of devastation from happening if you come in early.
All right, well, let's talk about that. Let's talk about a few prevention strategies for maintaining a healthy heart, like eating and things of that nature. What should that look like, the do's and don'ts?
So we talk about that 80% of heart disease is preventable. So those things that you can do, first of all, consider how you eat. Like, look at your diet, look at those things that you put in your body. For example, you can stay away from fried foods, decrease the high sugars, select something like fruits and vegetables, cut down on the carbs, look at the way you're eating, cut down on sugary drinks. Those really help. Lean meats like chicken and fish actually helps. The second thing that you can really do is start adapting how you really see yourself in the physical realm. Exercising, walking more, 30 minutes a day, start gentle and go more. The other thing that you can do is know your numbers. Talking about establishing yourself with a primary care provider, knowing what's your blood pressure number. Is that number less than 130/80? Knowing your cholesterol number, and that's just a panel of blood work that you're going to get to know if you have high cholesterol. Knowing your blood sugar. Do you have diabetes? Because that will really empower you, because when you know these things, it's going to help you. The other thing that I would like to let women to know about is what we call coronary calcium score. If you have a family history of heart disease already, and you know that history, if you have high blood pressure, diabetes, you really want to know what that coronary calcium score number is, if you're already building up calcium, because then we can be more rigorous on how we help you to prevent the worsening of that situation that you may be in. So empower yourself. There's nobody else that can really do that better than you can. So do it today. Just start today. If you need guidance, we're going to be there on February 2nd at Gate City Boulevard. You're going to be able to meet other women, empower and just inspiring each other as you go on the journey of healthcare. So we're excited to be able to do this for the community.
Yeah, and we'll put a link to that February 2nd event as well. You said know your calcium score. How do you get to know your calcium score? Is that just a test or a blood test, or?
Thank you. I'm glad we came back to that, because I really want to talk a little more about this. The calcium scoring tool is a CT scan, essentially. You have to really meet certain criteria, like your age over 40 and high blood pressure, diabetes, and it gives you a certain number. If you're in that bracket, it's a CT scan that you can be able to schedule and do. And that really helps predict what you have, because if you have a 0 number, that means like, okay, you haven't built up calcium. But if you have a family history and you do have that, it helps us really guide you in what you need to do for the next step of prevention. So that's really important. So think about it this way, as a mammogram. Like, most women get their mammogram every year. It's almost like that. The difference is that you can only do once, So think about it that way, because it's something that really guides that process of knowing what you have there and already empowering yourself how you move forward.
Okay, we've got a little bit under a minute. What about smoking? How does that figure in?
Smoking plays a big part of this, and thank you for bringing that up because smoking is one thing that if you're a smoker, you want to quit. And I like to share with the audience that we do have, if you go to conehealth.com/smoking, you can find tools there that can help guide you on how you can quit smoking and maintain being a smoke-free person.
Okay, great. Thank you for your time and expertise. And again, we will put that link for that February 2nd event in the To Wants to Know section, although to your well-being section as well. Right now, we're going to take a quick break.